Thank you very much, Governor Shumlin, and it's a pleasure to be here with Senator Leahy and Congressman Welch. I think we have a team that is bringing a lot of positive direction to the state. I think everybody here understands that these are very tough times for the United States of America and the state of Vermont. In terms of health care nationally today, 50 million Americans do not have any health insurance whatsoever. Many more are underinsured, and as a nation, we spend far, far more per capita on health care than does any other country. And at the same time, today, insurance costs continue to soar. In my view, if the Vermont State Legislature, the governor, and the congressional delegation are able to work together effectively, and I believe we will, we have a golden opportunity today, not only to significantly improve the healthcare system in the state of Vermont, but equally important, be a model for the rest of this country in moving America forward in a very new direction in terms of healthcare. And I think we're all pledged to do everything we can to make that happen. My views on this issue, which I think are shared by the vast majority of the people in our state, are pretty simple. Number one, in my view, health care is a human right and should be available to every man, woman, and child in this state, regardless of income. Number two, at a time when our nation has by far the most expensive and wasteful system in the industrialized world, spending 30% of every healthcare dollar on bureaucracy and administration, there is no reason why the small state of Vermont cannot construct the most cost-effective, high-quality healthcare system in the United States. We want our healthcare dollars to go to preventing disease, to curing illness, not into profiteering and bureaucracy. Vermont can lead the nation in that direction. Lastly, and I think Governor Shumlin has made this point many times, when we talk about healthcare reform, we're not only talking about the needs of the individual, we're talking about economic issues. Businesses all over our state and our country are being hurt because of soaring healthcare costs. They want a cost-effective system. And I believe when we do that, it will make this state much more business-friendly and create jobs in our state. Very simply, and I think Senator Leahy made this point, what we are doing in Washington right now is saying that in the current law, and I put this provision in the healthcare reform, we try to get language in the bill that in 2014, when healthcare reform is implemented, states could have the flexibility to go forward with a system that maintains all of the standards in the national bill, but could do it better, more cost effectively. Give states the opportunity to be the laboratory of success in this area, for reasons which I will not go into, because they are the reasons that make people very suspect about Washington. The original language of 2014 was pushed back to 2017. Our job now, when we've introduced legislation at the end of the last session, and we'll reintroduce it again, Senator Leahy is the original co-sponsor, and Congressman Welch is working on this in the House. We're going to try to get that date back to 2014, so when healthcare reform is implemented, Vermont will have the flexibility to go forward with a Medicare for all single-payer system. And when we do that, I think it will be a wonderful day for this state and for this country. Thank you.
Thank you very much. This is a very